Okay, now let's go over each movement again in review. I'll move out of the way up here. All right, so let's start with the sagittal plane movements. Sagittal plane movements are front to back, and they are flexion, extension, and hyperextension. And they can happen in the shoulder joint, flexion, in the shoulder joint, extension, back to anatomical. And then you also have hyperextension of the shoulder where it goes further back. In the hip, you have the same. Flexion, extension back to the anatomical, and then hyperextension further back. In the knee joint, you have only flexion and extension. Just like in the elbow joint, you only have flexion and extension because those joints aren't built to hyperextend. Okay? All right, now we just talked about this, but I want to review it again. So dorsiflexion is two bones coming. The definition of flexion is two bones coming together, and dorsiflexion is talking about the surface of the foot coming closer to the shin bone or the tibia, right? So dorsal fin is the dorsal side. And then plantar flexion is two bones coming together based on the planted surface of the foot, the plantar side, and that's plantar flexion. So we've got two flexions here, but they're based on the surface. If we stick to the anatomical rule that I like, right, dorsiflexion is actually ankle flexion, and plantar flexion is actually ankle extension. Right? So we have dorsiflexion and plantar flexion, and then we have just regular flexion and extension based on the sagittal plane. Dorsiflexion equals ankle flexion. Plantar flexion equals ankle extension and ankle hyperextension. Right? So flexion is moving from the anatomical up. Toes up, heels down. Extension is going back to the anatomical position, and hyperextension is further back from that. So the ankle can extend, hyperextend, and flex. All right, we've got some other movements here. This occurs in the sagittal plane, and it's this. Right? Remember this old push your head, right? Opposition. Right? It's what humans can do. Not too many other animals have thumbs that can do this, that can grip. So this is called opposition, right? And then going back to the anatomical would be reposition. Opposition, reposition, or reposition. Opposition, reposition. That occurs in the sagittal plane. It's a different kind of movement, right? It's kind of an extraneous movement, but it's something to talk about because it happens in the sagittal plane. Now we're going to move to the frontal plane, okay? So the frontal plane here, where am I going to go? Is moving side to side. Remember the narrow room? So not moving front to back, but moving parallel to side, and that's abduction away from the body, and then adding to the body is moving towards the middle, and that's adduction. So let's talk about the shoulder here, really. This is a good example. So if we abduct the shoulder, I'm moving away. Oh, let's look at this side right here, right? If we abduct, I'm moving away. I'm still abducting, but look, if I keep going, I start to move towards. Is that adduction? No, it's not. Okay, so wherever it starts from the anatomical position is what it is all the way through the range of motion. That's abduction. So adduction, this kind of looks like I'm moving away first. So abduction, no, from here down is adduction, right? So where it ends up, or where it is relative to the anatomical position, the anatomical position is what's most important, right? So abduction away, adduction toward. And you can do that with your wrist, you can do that with your shoulder, you can do it with your head, you can do that with your hips, we talked about that. You can do that with your ankles. All right. Next slide. Inversion, eversion. Now here's a cool picture. Inversion and eversion can also be called in the foot pronation and supination. Eversion is big toe down. That's also pronation. So if you walk like that, that's pronation. And if you invert, if you do inversion, and that's toe up, that's the same as supinating, walking on the outside of your feet. That occurs in the frontal plane. Okay? Good. Other movements that occur are elevation and depression, and this is your shoulder blade just sliding along your ribcage like shrugs, right? The I don't know exercise. This is elevation, elevator goes up, and this is depression, going down. So sliding up, elevation, depression going down. That's in the frontal plane, elevation and depression of the shoulder. The name of this joint is the shoulder girdle. You're going to have to know the names of the joints, right? The neck joint, the shoulder joint, right? The shoulder girdle joint is the movement of just your shoulder blade, not your arm, your shoulder blade. And it supports your arm movements. Okay? Good stuff. What are some other common names of joints? Your elbow, your knee, your hip, your trunk, that's your spine. Trunk, remember that, your trunk. Your finger joints, your wrist, your radial ulnar joint, your forearm joint is your radial ulnar joint. Good stuff. All right, what else can we do with the shoulder girdle? Well, we can move your shoulder blades apart, and that kind of sets your shoulders up forward. You're kind of rounding your back a little bit, right? We've got protraction, and that is abduction, moving away from the center, abduction of the shoulder girdle. And then adding to the body, pinching your shoulder blades together, is retraction, or adduction, adding to the body. There you go. And that occurs in the frontal plane because it's sideways. All right, let's talk about the transverse plane, and that's rotating on an axis, right? All right, now this, I'm demonstrating this, but this is actually pronation and supination. We already talked about it, right? Which one is this? Is my radial ulnar joint pronated or supinated? It's pronated. I'm in a prone position, like belly down. Lying in a prone position is belly down. So pronation is that palm up, is supination. That's not what we're talking about here. We're talking about rotation. So this, right, I can rotate my neck as if I was driving, if I had a rod through my body, from my head to out the bottom of my body, I could spin on that rod, and that's rotation, right? I can do that with my arms. I can do that with my legs. So the shoulder can rotate, shoulder joint can rotate inward and outward, right? And then the hip can move the leg, can inward rotate. Inward rotate is known as also known as, look at the picture, medial rotation. Medial's towards the middle of the body, lateral's towards the outside. So medial rotation is inward rotation, lateral rotation is outward rotation, and you can do that with your shoulder joint. You can do that with your hip joint. So if no is rotation, what is yes? Yes is flexion, extension, vigorous yes, hyperextension. So yes of the neck, or saying yes with your head, is flexion, extension, hyperextension of the neck, and no is rotation. Pretty cool. And that's in the transverse plane. Next slide. All right, pronation and supination, we already talked about that. Pronation, supination is also in the transverse plane. Okay, very good. All right, now multiple plane movement, circumduction. So if we take our shoulder and we start in a little bit of shoulder flexion, Then we switch from shoulder flexion to shoulder abduction, and then go back to shoulder hyperextension, right? And then come into a little shoulder flexion. What we're doing is we're moving in a conical movement, right? Here's the point, and then we're making a circle at the end of our arm with our hand. That is circumduction, and that occurs in multiple planes because it has a little bit of flexion, extension, hyperextension, add an abduction in it. It has all those movements wrapped into it in one, and it's an angular movement, and it's called circumduction. Good stuff. All right, so now we got to start putting all this stuff together because you're going to be tested on this stuff in a quiz that just talks about movement. You're going to have to tell me when I do this, what is that movement? All right, when I do this, what is that movement? Well, this is shoulder, name the joint, shoulder flexion, right? This is shoulder abduction, right? And certain joints do certain movements, and you're going to have to name the joint, name what it is. Here on this slide are all the different movements. This is anatomical movement by joint. So just like I said before, we have the shoulder girdle, we have the shoulder joint, we have the elbow joint, we have the radial-ulnar joints, or the one in each arm, right? So the radial-ulnar is basically the forearm joint, right? Wrists, the vertebral column, otherwise known as the trunk. We have the lumbrosacral joint, and that's basically your hips, or your pelvic tilt is your lumbrosacral joint. It's the bottom of your spine where it goes into your hip bone is your lumbrosacral joint. Then you also have your hip joint, and that's where your legs come out. Your lumbrosacral joint is how your spine goes into your hip bone, and your hip joint is where your hips connect to your legs. Your knee joint, you know what that is. Your ankle joint, you know what that is. Your intertarsal joints. Intertarsal joints it's basically your ankle, kind of your ankle, right? It's like the bottom part of your ankle, and that's what makes you able to go big toe down, big toe up, intertarsal joints. So we already went over these movements, but now we're organizing them by joint, right? So we know we organized them by plane in the previous slides. Now we're organizing them by joint, just so that you memorize them. You got to get this stuff into your head, right? So the shoulder girdle is your scapula, which is your shoulder blades, and they do elevation and depression, add and abduction. Remember, protraction, retraction, same as add and abduction. Upward rotation, so your shoulder blades can pivot out, and downward rotation, they can pivot in. Your shoulder joint can do a bunch of stuff: flexion, extension, hyperextension, add and abduction. It can rotate inward and outward, and it can do a new one. Let's talk about this new one: horizontal flexion and horizontal extension. What is that? Well, when you bench press, right? When you bench press, you kind of move to the center like this, right? And that is different than just shoulder flexion, which is from the front. Shoulder flexion, shoulder extension, it's different than that. It's different than shoulder abduction and adduction. If your elbows are up and you're coming together, you're in a horizontal, you're in the transverse plane, right? But you're bringing your bones together. So that's horizontal flexion, horizontal extension, and then if you go deep down in like a fly and you go deep, your elbows are further back, then that's horizontal hyperextension. Now you can also call these because it's in a transverse plane. You could also call this, based on the naming procedure, the naming protocol, you can call this movement horizontal adduction, ADD, or horizontal abduction, Horizontal add and abduction, right? Okay. But you can't, there's no such thing as horizontal hyper abduction. So it's best, and that's why it's listed here, it's best to call, when you do a bench press or when you do a fly movement at the shoulder, it's horizontal flexion, horizontal extension, and maybe horizontal hyper extension. Wrist joint can do all these things. It can flex, extend, hyperextend, and then you've got radial and ulnar flexion. So in the anatomical position, let me stand up. In the well, it's hard to do with the camera the way it is. Flip this around, right? Right. So if you're going to, that's the way your hands would be. If they're by my side. If you're going to go inward towards the body, what is that? That's radial flexion on the radius side, or it could be wrist adduction, ulnar flexion, is like abduction, right? So you have two bones, the radius and the ulna, right? The radius actually rotates around the ulna, all right? And you have wrist adduction and wrist abduction, right? And you can name the movement by the bones that it's converging on, or name it based on the anatomical movement. We just talked about that. So towards the body, adduction, away from the body, abduction, that's for the wrist, or radial flexion, ulnar flexion. Vertebral column, your spine, or your trunk. You could also call the joint your trunk. Flexion, extension, hyperextension, lateral flexion. Lateral flexion meaning add an abduction. Another way of saying add an abduction is lateral flexion. And rotation. Pelvic tilt. So you can stick your butt out or you can tuck it in, and that's pelvic tilt, and that's from the lumbosacral joint. Hip joint, just like the shoulder joint, flexion, extension, hyperextension, abduction, adduction, medial rotation, lateral rotation, or inward and outward rotation. Okay? So remember, the shoulder joint and the hip joint can also do circumduction. Not listed here, but you can do it. All right. Knee joint, flexion, extension, that's all it can do. Ankle joint, flexion, extension, hyperextension, or plantar flexion and dorsiflexion. We talked about that. And then the intertarsal joint, right? The bottom part of the ankle, like the foot, the bottom part of the foot can tilt either side, eversion, inversion, pronation, supination. Got it? All right. This is stuff that you're going to have to memorize, all right? And you're going to have to go over it and over it and over it and over it, because I'm going to ask you, I'm going to demonstrate a movement. You're going to have to tell me the joint that's moving, the anatomical name of that movement, and some of them have multiple names. As long as it's right, it's okay. You can use whatever name you want as long as it's the correct name of the movement. And then you have to tell me the prime mover. What is the prime mover? The prime mover is the name of the muscle that's actually moving the joint. So you're going to have to also memorize the names of the major muscles of the body. And there's so many different muscles in the body, but you just have to know these few. Okay? You have to know the shoulder muscle is the deltoid muscle. The chest muscles are, one of the major chest muscles is the pectoralis major. The main anterior portion of the upper arm is the biceps muscle, biceps plural, right? You have to know that the six-pack is known as the rectus abdominis. Brachialis, yeah, that's another arm muscle involved with flexion, but biceps do most of the work. So yeah, it's nice to know the brachialis. It's not that important. External obliques, you're going to need to know that, because external obliques do what? They rotate your trunk or your spine, right? The brachioradialis is a forearm muscle, and you got finger flexors and things like that. Do you need to know the adductor longus or the gracilis? Yes. Why? Because they do hip adduction. Sartorius, cool muscle. It helps with what? If you imagine that muscle flexing, what would it help? Right. Well, it could aid in a little bit of rotation of the hip. Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis, not shown right here, are the four quadriceps. You just need to know them as the four quadriceps. Right? Tibialis anterior, ankle flexion. I need to know that. Trapezius does shrugs or shoulder girdle elevation. Rotator cuff. Rotator cuff helps you rotate, right? So you've got the infraspinatus, the teres major. These are muscles that are going to help you laterally rotate your shoulder joint. Latissimus dorsi helps with shoulder extension, shoulder hyperextension. Latissimus does that. Finger extensors do finger extension. Gluteus maximus, what does that do? It does hip extension, hip hyperextension. Semitendinosus and the biceps femoris and the semimembranosus, they do hamstrings. They do knee flexion. Gastrocnemius, which is biarticulate, biarticulate. Gastrocnemius is biarticulate, meaning it crosses two joints. It crosses, the gastrocnemius crosses the knee joint and the ankle joint, and the gastrocnemius helps with knee flexion and ankle extension. Soleus is singularly articulate, right? So that does the ankle extension. You need to know these, right? You need to know the muscles that do the movements for the joints. Three things. So you've got the joint, the movement, and the prime mover, meaning the main muscle that does the concentric contraction, as we talked about. The shortening of the muscle to cause the joint to move is what we need to know. All right. So now, I'm going to squeeze myself in over here. Now we've got major muscle groups and their most common movements, right? So the deltoids and the upper trapezius move the shoulder, right? So we've got flexion of the shoulder, raising the arm in front, is done by the deltoid muscle, the shoulder muscle. Abduction, raising it out to the side, is also done by the deltoid muscle. Right? Anterior is the front part of it. The middle deltoid is the side part of it. Elevation of the shoulder girdle is the trapezius. Elevation of the shoulder girdle, right? The sliding of that shoulder blade up. Back, your lats, the big muscle in your back, right? What does that do? It does extension of the shoulder. It does abduction of the shoulder and hyperextension. What does the chest muscle do? The pectoralis major and its younger brother, the minor. Pec major and minor, they do what? Horizontal. Remember we talked about horizontal flexion, and that's for like a fly. All right, you need to know this for this movement quiz we're talking about. Upper back. Upper back, like the trapezius and the teres major and minor and the rhomboids, right? These are all small muscles around the back. Horizontal extension, so pulling your arms apart with your arms up, and horizontal hyperextension, right? This is your rhomboids and your rear delts and your lats. Bis and tris, we know what they do. Hopefully you know what they do by now. Movement at the elbow joint, right? Flexion's responsible, or the biceps are responsible for flexion, and the triceps are responsible for extension. And here some of them are. Good stuff. All right. Abdominal. Your external obliques cause rotation of the trunk. Flexion is the rectus abdominis. And then we already said that one. And then stabilizers. All these muscles help stabilize the trunk. Your lower back. Your low back muscles. Those muscles are known as the erector spinae. All right. And they extend your back. And they're like the reverse of a crunch. And they also stabilize movements at the hip. So we've got ab muscles for crunches, and then for hyperextensions or for extensions of the trunk, you've got the erector spinae. Hip flexors. All right, flexion of the hip. Right. What are the hip flexors? Well, you've got that one. You've got small muscles. And you've also got that one quadricep, that rectus femoris, that is biarticulate. It crosses the hip, so it helps to flex the hip. It also crosses, so that one muscle also crosses the knee joint. You've got a bunch of little hip flexors, and you just call them hip flexors. The buttocks, which is the gluteus maximus, does extension and hyperextension of the hip. The inner and the outer thigh includes the quadriceps. But we've got abduction, the outer thigh. Abduction is the gluteus intermedius. The inner thigh, right, or the groin muscles that do hip adduction, holding you on the horse, that inner thigh, that's the gracilis. Remember the gracilis? Gracilis does inner thigh or hip adduction. All right. We've got movements of the knees, flexion, extension. So flexion is the hamstring. Extension is the quadriceps at the knee. That's easy. Then we talk about the calves, the gastrocnemius, the big muscle that's biarticulate, the soleus, that's one. And then the anterior tibialis, or in reverse, the tibialis anterior, same thing. Good stuff. All right, so what is this quiz about? Don't freak me out with quizzes. It's 15 questions. It's easy. I'm going to show you an anatomical movement. I'm going to go slow. You're going to show me or tell me what the joint is. You're going to tell me what the anatomical movement is: flexion, extension, hyperextension, rotation. It's one of those. And then what the muscle name is, or muscles. You can throw 2 in there if you want, but I want to know the main mover, the prime mover. Right? This is important because your grade and whether you're listed as a professional, expert, or master personal trainer through the NASN is influenced by how well you do on this quiz, because it's 25% of your grade. Don't freak out. If you need to retest on this quiz because you did horrible and you're not getting it, we'll allow that if there's time at a seminar. If there's not time, you could take it at a later date. But you're going to take this quiz before you finish the resistance training course. Okay? And that is it for lesson 4. Study up and thoroughly go through lesson 4 before you hit the next one, lesson 5.